Have you ever wondered how to get a mental health diagnosis? It may seem like a complex question, but today we're here to make it a little simpler. Mental health, an integral part of our lives, often takes a back seat in the hustle and bustle of our daily routines. Yet, acknowledging its importance and understanding how to seek help when needed is crucial. In this video, we'll be navigating through the process of getting a mental health diagnosis. We'll talk about recognizing the signs that suggest you might need to seek help and guide you through the steps of navigating healthcare systems. We'll also discuss your rights as a patient, the confidentiality you can expect, and what life can look like after a diagnosis. Understanding the process can make the journey less daunting. So, where do you start? Stay tuned as we delve into the first step, recognizing the signs. The first step in getting a mental health diagnosis is recognizing the signs. That's where we are right now, at the beginning of understanding. Now, it's important to remember that mental health issues can present themselves in a variety of ways. And these symptoms can be as unique as the individual experiencing them. However, there are some common signs that may indicate a need for further exploration. Perhaps you've noticed persistent feelings of sadness, anxiety, or emptiness. Maybe you've lost interest in activities that once brought you joy. You might have noticed changes in your appetite or sleep patterns, or maybe you're grappling with feelings of worthlessness and guilt. Physical symptoms can also be linked to mental health, such as unexplained aches and pains or constant fatigue. Now, it's crucial to understand that experiencing these symptoms doesn't automatically mean you have a mental health disorder. Life is full of ups and downs, and it's entirely normal to have periods of feeling down or anxious. It's when these feelings persist or start to interfere with your everyday life that it might be time to consider seeking help. Let's take a moment to talk about that interference with daily life. Maybe it's becoming harder to get out of bed in the morning, or perhaps work or school is feeling overwhelming. Relationships might be suffering, or you may find yourself avoiding social situations altogether. In some instances, there might be thoughts of self-harm or suicide. These are all red flags that something may be amiss. Remember, everyone experiences mental health differently. What might be a routine stressor for one person could be a significant trigger for another. It's not about comparing yourself to others, but about understanding your own unique experience. Finally, mental health is not a character flaw or a sign of weakness. It's a critical part of our overall well-being, just like physical health. So, if you're experiencing symptoms that worry you or interfere with your daily life, don't ignore them. If these signs persist or affect your daily life, it may be time to seek professional help. Our next step will be discussing how to navigate that process. So, keep listening, and remember, it's okay to reach out. Before we continue, remember to hit that subscribe button. By subscribing, you'll join our community of like-minded individuals. Together, we can achieve success and wealth as we learn, grow, and support each other. Click subscribe now, and let's dive back into today's topic. So, you've noticed persistent signs. What's next? It's time to seek professional help. But first, let's clarify who these professionals are. There are psychiatrists who are medical doctors specialized in mental health, including substance use disorders. They're qualified to assess both the mental and physical aspects of psychological problems. They can prescribe medication, and they also use a range of treatments, like psychotherapy, psychosocial interventions, and electroconvulsive therapy. Then we have psychologists, who have a doctoral degree in psychology and are experts in human behavior. They're not medical doctors, but they have extensive training in diagnosing and treating a variety of mental health conditions. They use techniques based on the best available research and consider your unique values, characteristics, goals, and circumstances. And let's not forget therapists or mental health counselors, who have a master's degree and are trained to understand and treat mental health issues through talking therapies. Finding the right professional for you might feel like a daunting task. But don't worry, there are resources available. You can reach out to your general practitioner or local health department for recommendations. Online directories can be a great place to start too. Look for a professional who specializes in the issue you're facing. And remember, it's perfectly fine to shop around until you find someone you feel comfortable with. The initial consultation is a crucial part of this process. It's your opportunity to share your concerns, ask questions, and get a feel for whether this professional is a good fit for you. Don't be hesitant to express your concerns or ask about their experience and approach to treatment. Navigating mental health can be a challenging journey, but remember, seeking help isn't a sign of weakness. It's a sign of strength. It shows you're taking charge of your well-being and making a commitment to a healthier future. Remember, it's okay to seek help. It's an important step towards understanding and managing your mental health. Once you've reached out to a professional, it's time for the diagnostic process to begin. This journey is unique for everyone, but there are some common steps that you can expect. The first step often involves a comprehensive interview. This is a chance for the professional to understand your background, your symptoms, and your experiences. You might be asked about your personal life, your family history, and your overall well-being. Don't worry, there's no right or wrong answer. It's just about getting a complete picture. Next, a mental health assessment may be conducted. This could involve questionnaires or structured interviews that are designed to measure various aspects of mental health. These assessments can help professionals to identify specific mental health conditions, like depression or anxiety. They can also provide valuable insights into how your mental health is affecting your life. In some cases, further testing may be needed. This could include physical examinations or laboratory tests to rule out other health conditions that might be contributing to your symptoms. It's worth noting that mental health is complex and sometimes it's linked to physical health. So, don't be surprised if your healthcare professional recommends a full checkup. You should also be prepared for the possibility of multiple appointments. Mental health diagnoses aren't always clear-cut, and it can take time to arrive at the most accurate diagnosis. This isn't a reflection on you, but rather, it's a testament to the complexity of the human mind. Finally, it's crucial to remember that the diagnostic process is a collaborative effort. Your input is valuable, and your healthcare professional should value your perspective. Don't hesitate to ask questions, share your thoughts, or express any concerns. After all, this is about your health and your life. Getting a diagnosis can be a relief, but it can also be overwhelming. It's important to remember that a diagnosis is just a tool to help manage your mental health. It doesn't define you or limit your potential. It's simply a starting point for understanding and addressing your needs. As a patient, you have rights, and confidentiality is a key part of these rights. It's essential to understand this principle as you navigate your mental health journey. Being aware of your rights fosters a sense of control and participation in your own care. Confidentiality is critical in maintaining trust between you and your healthcare provider. It assures you that your personal and health information won't be disclosed. Without your consent, creating a safe space to express your concerns freely. Informed consent, another important right, means you're entitled to comprehensive information about your condition, the benefits and risks of proposed treatments and any alternative options. This right ensures you're fully equipped to make decisions about your health. Understanding these rights empowers you to take an active role in your mental health care. It's about you, your health, and your life. Your privacy and autonomy are paramount in this process. Always remember, you have a right to understand and participate in your own care. So, you've received a diagnosis. What happens now? First and foremost, it's essential to remember that a diagnosis isn't a label that defines you. It's a tool, a starting point that helps you, and those supporting you, understand what's going on so that you can manage it effectively. Now, let's talk about potential treatment plans. Treatment for mental health conditions is highly individualized and can encompass a variety of strategies. This may include medication, cognitive behavioral therapy, lifestyle changes, or a combination of these. It's important to work closely with your healthcare provider to develop a plan that suits your needs and lifestyle. And speaking of lifestyle changes, let's address the importance of self-care. Self-care is about taking time to do things that nourish you physically, emotionally, and mentally. This could be anything from taking a walk in nature, practicing mindfulness, to ensuring a healthy diet and regular exercise. It's about finding what works for you and making it a part of your routine. While treatment and self-care are crucial, equally important is the support from those around you. Reach out to family and friends, join support groups, or seek professional help if needed. Remember, it's okay to ask for help. Living with a mental health diagnosis might seem daunting at first, but it's important to remember that you're not alone. Millions of people around the world live fulfilling lives with mental health conditions. A diagnosis does not limit your potential or your ability to lead a satisfying life. It merely highlights an aspect of your well-being that needs attention and care. And let's not forget, progress might not always be linear. There will be good days and not so good ones, and that's okay. The key is to keep going, to keep learning about yourself and your mental health, and to keep striving for well-being. A diagnosis is not the end. It's the beginning of a journey towards better understanding and managing your mental health. Thanks for watching. Embrace the shadows, hit subscribe, and stay tuned for our next video. Until then, harness the darkness and forge your path to greatness.